Texas Medical Center is the largest medical city in the world, consisting of 54 member institutions. It treats 7.2 million patients a year, so it's enormous. What's exciting is we're driving 5 institutes across the medical center: Health Policy Institute, Genomics Institute, Regenerative Medicine, Innovation, and Clinical Research. And what's exciting about this is we're actually creating a 30-acre campus that will hold these institutes together and really leverage the greatness of MD Anderson and Baylor College of Medicine and Rice University and University of Texas and Texas A&M. So these great assets, we're going to really focus them around innovation. It really gives them the largest incubator in the world to really prove the value of a lot of these emerging technologies, whether they be diagnostics or software solutions, but really allow it a vehicle to really understand the value of those and drive them through this largest infrastructure in the world. I look at this from both the institution side and also as a serial entrepreneur. I think what's most important is not just to bring technology to bear, but really bring technology that makes life easier. I always focus first on nurses because they're the front lines of healthcare. And bringing it to them early on, they are the ones that are really stewarding the great care, bringing people through. And if it survives or if it's successful and value added to nursing, then obviously physicians are involved in that process as well. But I think too often people look past the fundamentals because physicians are overburdened with patients. They want to be streamlined. They want to treat the sickest patients. And we've got a facility-based system where everyone comes to facilities. So make sure that those solutions are truly better for patients, better for the system in treating them, and drive down costs. Those are the key fundamentals to any entrepreneur being successful in this space. Texas, and particularly in Houston, is one of the fastest growing cities in the country. It's growing 100,000 this year, very successful in both the energy and in the health industries. And yet it's also the most diverse population, which is tremendous because you can have a solution that may be a great solution in Boston, but if it's not really treating a diverse population, and particularly the underprivileged and underserved, then you're really missing the boat about bringing a new platform, because gone are the days where you can bring a boutique product into the market that's great for just a few people. The problems that we face across not just this country but around the world, you need to have solutions that are really delivering for the broad, diverse population. So always keep that in mind, and when you test those products, make sure you bring it also first to patients so that their interface is a natural one. If you listen closely to patients, they'll tell you exactly what they need, and you can't look past them and just show up and expect them to adopt it. I think when you look at some of the problems that we face, we can generalize in diverse populations around the world, but obesity is the number one. Sedentary population. I spent my childhood playing outside from the time I came home from school to the time that I had to have dinner. This population is at home and on iPhones and iPads and much more sedentary. The incidence of diabetes, the incidence of obesity is a plaguing problem. I would direct entrepreneurs to start looking at the big problems and not trying to solve them all together, but bringing solutions that are popular in the community. I would say if they're not mobile based, then they're missing it altogether. And so that the more that they think about applications in the same way that Steve Jobs thought about applications, they have to be easy, simple to use, and they have to add value to the system. One, it has to be thoughtful in the way that it adds value. And I often bring that when someone has a software solution, if it's not integrated into the mainstay solutions that are out there, the Epics or the Cerners of the world, then it's just an additional burden to a CIO that has the problems of the entire enterprise. So I'm often guiding people to say, it's okay that you've done it with a small group practice, but if you're going to truly bring this into mainstay of healthcare, it better interface with the general population of applications and seen as an additional layer And those are where the opportunities, because most of those systems are not mobile based. They're event facility based. So if they can bring the community in and monitor patients afar and add value, terrific, it fits in. But they should be thinking about interfacing to the existing ecosystem rather than trying to create yet another one. I'm always looking for a combination of two things. One, that someone has identified a very big unmet need. So the days of creating a me too, a little bit better product, there's just too much noise in the space for you to exist as a small company. So it has to be a big transformative idea. Yet the focus has to be in a very stepped fashion so that you're accomplishing very meaningful milestones all along the way. Otherwise, you want a venture capitalist that invests in with you, well, they don't want to invest in something unless it's going to have a tremendous return. However, if you get lost in the long-term vision and you don't execute in short, consistent milestones, you don't build that credibility that allows you the runway to get there. So I often think that people raise much less money than they actually need. And yet the milestones that they accomplish are not as well designed as that they need to be, because when that happens, you start to come out of form with your venture arm, and then the company changes considerably. So big idea, but also execution on the milestones along the way.